Assalamu alaikum wa rahmatullah wa barakatuh. The third process of pharmacokinetic is metabolism. Also, it's called biotransformation or detoxification. الميتابوليزم تعني الأيض أي أيض الدواء. biotransformation التحويل الحيوي. و detoxification تعني إزالة السمية. Metabolism could be defined as it is chemical changes in drug molecules that take place after absorption. Liver is the main organ of metabolism, but also it may take place in many other organs like kidney, muscles, skin, etc. What is the importance of metabolism? The first importance is mostly loss of activity. And this is an important thing because if the drug did not lose its activity, it will continue act on the body for long time. So it must be stopped. The metabolism achieve this purpose. But also, from the other hand, there are some drugs become active after metabolism, like chloral hydrate. Chloral hydrate is anesthetic drug used in surgery, and it's become active after metabolism. The second importance is metabolites. It's more water soluble, so they are more easily excreted. You know, the urine or the kidney excrete the water soluble substances, not lipid soluble substances. So the metabolism make the drugs more water soluble, so they are more easily excreted. The third importance is metabolism decrease duration of action, as we said in the first importance. What are the pathways of metabolism? There are 4 pathways: oxidation, reduction, hydrolysis, and conjugation. The first 3, which mean oxidation, reduction, and hydrolysis, called phase 1 metabolism. The conjugation alone called phase 2 metabolism. The major pathway from this 4 is oxidation and conjugations. The first pathway is oxidation. It takes place in the microsomal system in the liver, and it needs some requirements, which are: so this pathway occurs place in microsomal system in the liver and needs some requirements. First, it needs cytochrome P450. It needs NADPH. It's mean nicotinamide adenine diphosphate. It is an enzyme. It needs O2 oxygen molecules. Also, it needs enzymes like oxidase. There are many types of oxidations, like aromatic hydroxylation. Aromatic hydroxylation, in which hydroxyl group, OH group, added to the aromatic ring of the drug. When the drug have aromatic ring, a hydroxyl group added to the aromatic drug, to the aromatic ring of the drug. The second type is aliphatic hydroxylation, which means side chain hydroxylation, in which hydroxyl group added to side chain. There is in some drugs a side chain, the hydroxyl group added to the side chain. N-dealkylation, the third type, it means removal of alkyl group connected to nitrogen. The type 4 is O-dealkylation, removal of alkyl group connected to oxygen. Also, the fifth type is sulfoxidation, removal of sulfur group by O2. And the last one And the sixth one, deamination, removal of amino group from the drug. And the last one is desulfuration, removal of sulfur group from the molecule of the drug. What is the microsomal system that in it the metabolism or oxidation metabolism occur? It is found in the liver and considered as part of body defense because it acts only on foreign compounds and the oxidation takes place in it. So the oxidation process or the oxidation metabolism considered as a body defense against the foreign materials enter the body like drugs. What are the factors affected microsomal system? Of course, when some factors affected microsomal system, that means these factors affected oxidation, and that means these factors affected metabolism of the drug. These factors, like age, there are differences between a newborn, adult, and aged in their response to the drug. As we said in the type of response or factor affected response. In adult, the microsomal system acts not well acts, and in the newborn it is not complete. So there is differences between adult and newborn, between adult, newborn, and aged individuals. The other thing is species. There are differences between species, may be quantitation or qualitative. Like we said before, that the cats lack some enzymes which responsible about metabolism of aspirin. And in species variation, when we're talking about the factors affecting the response to the drug, cats or feline in general lack enzyme responsible for metabolism of aspirin. The third factor, diseases of liver. Of course, any disease in the liver will act or will affect the metabolism of the drug. Also, for drugs, some drugs may inhibit the enzymes, and the other drugs may inhibit the enzymes. Other drugs stimulate some enzymes in the microsomal system, like SKF 525A. This drug inhibits enzymes in the microsomal system, so it will affect the metabolism of the drug. Also, fifth, enzyme inducer, محفزات الانزيم. Enzyme inducer, some drugs may cause enzyme induction, like barbiturate. Barbiturate cause induction of enzymes in some in liver, so they affect metabolism. The second pathway of metabolism is reduction. Reduction occur in the liver. In the liver, some drug reduced to other compound. يصير بها عمليات اختزال. الهيدروليسيس, the third type, hydrolysis. Some drug molecule may be hydrolyzed to two or more molecules, leading to destruction of the drug. The fourth pathway is conjugation, which means synthetic. Conjugation, endogenous material added to the drug. These molecules are. That means إنه some molecules or in the body, found in the body, added to the drug molecules, like glucuronic acid, glucuronide formation, in which in this process glucuronic acid conjunct with the drug. Instead, one of these molecules Then that means a glucuronic acid molecule conjunct with the drug instead of one of these molecules, instead of OH or instead or an NH or S or COOH. Maybe there will be a question: what is the differences between this and oxidation? Some type of oxidation, as we see, like aromatic hydroxylation, hydroxyl group added to aromatic ring, and in the glucuronic conjugation, glucuronic acid conjugation, a glucuronic acid molecule added to the drug, and in oxidation, hydroxyl group like this added to aromatic group of the drug, while here there is glucuronic acid, a new compound, a new complete compound added or substituted with one of these molecules. هنا تجري عملية استبدال الجلوكونيك acid by the one of these molecules, OH or NH or S or COOH. Sulfuric acid conjugation, sulfate formation, in which sulfate group conjugate instead of functional group, and each drug have a functional group. That means the group which responsible about the action of the drug. So in sulfuric acid, a sulfate group conjugate instead of function group. Amino acid conjugation, in which amino group conjugate instead of function group, like the sulfuric group, but the difference is in sulfuric a sulfate group, but in amino acid amino group, and also the fourth type, acetic acid acetylation, in which acetyl group conjugate instead of function group of the drug. The last process in pharmacokinetic is excretion. Excretion defined as expelling of a drug out of the body. طرد الدواء خارج الجسم. There are many routes for excretion. The main route and the important route is renal route by kidneys. It is the main route. Most drugs excreted by this route. Also, there are some drugs excreted by biliary routes, of course, which mean bile, through bile. Also, there is a skin route by sweat glands. Also, by salivary route through saliva. Other route through milk, and there are many drugs excreted through milks. Also, pulmonary route, expired air, هواء الزفير, especially anesthetic drug, أدوية التخدير في العمليات. Also, there is intestinal route through feces, some vitamins excreted by this route. Renal excretion. So we will talking about renal excretion because it is the important one of these routes. Renal excretion is occur in general, not just for drugs, but in general. Renal excretion occurred by three processes. The first one is filtration. The first one is filtration. It is passage through pores, passage of the material through pores. In this mechanism, all molecules filtered except proteins. The membrane have no role, so it is passive transport. So, in this type, all the molecules pass through pores of the cell membrane, except protein. Why? Because the protein have a very high molecular weight. And the membrane have no role. The membrane have no role in this type of excretion, so it is a passive transport. The other process occurred in the kidney, reabsorption. It is rebag of filtered material. Of course, these materials are useful to the body from blood by simple diffusion. Increased lipid solubility make the reabsorption more easy. So these materials reabsorbed um, from urine to the blood by simple diffusion. And whatever these material are lipid soluble, the reabsorption become more easy. The third process occur in the kidney is active secretion. It is active transport in which the material pumped from the blood to the tubules against the concentration gradients. Of course, here, as we saw in all type of pharmacokinetic processes, there is factors determine the rate of excretion by kidney. First, the rate of metabolism. That means when metabolism is high, the rate of excretion is high, and vice versa. A presence of other route of excretion. If there is no other route of excretion, the renal excretion will be high. If there is an other route of excretion, the amount of drug excreted by kidney will be fewer. Route of renal excretion. This determine, that means, is the drug excreted by kidney by filtration? Does the drug undergo reabsorption, or is the drug excreted by kidney through active secretion? The process or the type of a process by which the drug excreted from the kidney is determine the rate of excretion. Also, the fourth factor is distribution of metabolism, which mean metabolites, which mean the metabolites, which are the result of metabolism, is they are highly distributed, because if they are highly distributed, that means it will be excreted in a fewer matter through kidney. The disappearance of a drug from the body, of course, after excretion, the drug will be disappear from the body. There are two terms determine the disappearance of the drug from the body: half-life and clearance. What's the meaning of half-life? Plasma biological half-life, which is called T-half. It's called T-half. Is the time required for half the concentration of the drug to disappear. الوقت اللازم لاختفاء نصف تركيز الدواء من البلازما مال الدم. التي-half ينحسب, it's calculated by, this is 0.693, this is a fixed number, divided on the K. What's the meaning of K? It is ثابت الانحدار. Here in this figure, we see the time after IV injection and the plasma concentration. So the differences between the disappearance of the drug and sometimes in any time and other time is called ثابت الانحدار, which is K. So the degree of this slope will enter here and determine the T-half of the drug. The other term is the clearance of the drug. It could be defined as volume of a plasma which completely cleared from the drug in minutes, and it's measured by liter per minute. That means liter plasma cleared completely in 1 minute. How many liter plasma completely cleared from the drug in minute? It's calculated by a drug concentration Of course, in drug concentration, that means the dose by milligram per liter multiplied by urine volume measured by liter per minute divided by drug concentration in plasma milligram per liter. And of course, when this milligram deleted with this milligram, it will stay liter per minute. Now there is something important to know. Of course, the kidneys have a glomerular filtration rate, GFR. That means how many urine, how many milliliters of urine filtered from the kidney. This called glomerular filtration rate. كمية اليورين التي تطرحها الكلى في الدقيقة الواحدة. So if the clearance of any drug, if the clearance of a drug, after we calculated this and the result was equal to glomerular filtration rate, that means renal excretion for this drug occurred by filtration. If the clearance rate is higher than glomerular filtration rate, that means renal excretion occurred by active secretion. While if the clearance rate lower than glomerular filtration rate, there is a reabsorption for this drug. This is the end of introduction, and after that we will begin with autonomic nervous system. Thank you.